With a name meaning strength and peace, Noah Gabriel Smurden was born at Community Hospital North on September 20th, 2007. Before his arrival, he was diagnosed with spina bifida, a birth defect that doesn't allow the backbone and spinal canal to close before birth, and trisomy 18, a syndrome caused by the presence of extra material from chromosome 18 that interferes with normal development. Due to the severity of his life-limiting conditions, this little boy was not expected to live longer than a week.
There was a lot of uncertainty, because of our diagnosis and the percentages. We didn't even know if we'd have an opportunity to meet him. And what obviously still brings tears to my eyes is the level of preparation going into his birthday.
But he surprised his parents, doctors, and nurses, going home and spending every day bringing joy to this world with big smiles and twinkling eyes.
We were really focused on, and our prayer had been to bring him home, and that is what we had asked people to join us in, is we want to be able to bring him home and have him with us. And we had quite a spell at about a week old where we thought we'd lost him multiple times. And then he just kept coming back. I called him the comeback kid.
Noah's parents treasured every moment spent at home with their baby, but they struggled to coordinate his daily care and find support for themselves.
We really had taken the doctors at their word when they said if you have a week it would be a miracle. And so that's the mindset we were in. All we need is to exist for a little while and try to continue to be in a space to enjoy him.
As Noah continued to beat the odds, the family fell into a healthcare gap, realizing a comprehensive perinatal and infant hospice program was not available in central Indiana. Since resources were limited, community caregivers worked with them to develop an at-home care plan. Noah's parents were taught to be nurses, tending to his open wound, facilitating a challenging eating schedule, and monitoring his breathing while he slept.
And so we found ourselves basically just asking for help. This isn't working anymore. Can we come back in and kind of reevaluate the way that we're doing it? And they were very open to scheduling time with us to do that. But it was still a matter of us going in, requesting the training, them graciously providing it, and then we're back home kind of on our own to tweak it and figure it out along the way.
Nearly 9 months after his birth, Noah died, June 14th, 2008. Since his passing, Noah's story has sparked historic healthcare change. Inspired by Noah, Community Health Network has opened the only comprehensive perinatal and infant hospice program in central Indiana. The program provides a full continuum of hospital and home-based medical, nursing, emotional, social, and spiritual care that begins at the time of diagnosis, continues throughout the limited lives of these babies, and lasts during the family's bereavement.
To be able to go into their home and provide all the equipment, all the skills, all the backup that they need in order to take care of them in their home, in their own private setting, and with their own family around them. It's pretty awesome to be able to provide that for families.
And so to allow these parents and families just the opportunity to share some time outside of a sterile hospital setting with their baby that they've grown to love and adore, I think is very valuable.
Reimbursements do not completely cover the program's costs, but donations made to Community Health Network Foundation's perinatal and infant hospice campaign will provide the financial resources needed to fund this important patient need.
Our donors can help close that funding gap and bring those resources to our patients and our family members so they don't have to worry about that. And we're able to give them and provide them with the services that they deserve. It's heartbreaking to think that these families are preparing to bring a baby into their family while at the same time preparing to say goodbye.
Everyone goes through it differently, both the time with the baby and loss afterwards. We just want to be able to see other families have the time and enjoy and have the support.
This project by far is one of the largest ways that Noah's time here has inspired something greater.
In Noah's honor, Community's caregivers established a code for the pages of priority perinatal and infant hospice calls. Code Noah is the call they now answer. Will you answer the call?